Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T U-verse Channel 99 and the WOW cable network. I'm Dr. David Balle, and I'm your host for In a Heartbeat. Sinus infections, or sinusitis, is a common condition with more than 24 million cases occurring annually in the United States. Many of you may know somebody who's had this condition, or sinusitis, or may have had it yourself. Most cases of sinusitis resolve within 10 days, but the condition can be serious and last for more than 3 months, and possibly could lead to a dangerous infection of the brain or facial bones. To help educate us about this important disorder, I've invited noted otolaryngologist Dr. Douglas Kubek to our program today. He'll be discussing acute and chronic rhinosinusitis, including its causes and treatments. So I'd like to extend a warm welcome to Dr. Kubek. Welcome to In a Heartbeat.
Thank you for having me.
Dr. Kubek, I'd like to start out by having you tell us a little bit about your background in your practice.
I've been a partner with the Lakeshore Ear, Nose, and Throat Center now for 4 years, and we're the largest private group in the southeast Michigan area. We're a group of 15 specialty ENTs, and we cover a full gamut of problems. My specialty is sinus surgery, facial plastic surgery. I'm also have a board certification in facial plastic surgery and sleep medicine and sleep disorders.
That's a lot of years in schooling.
A lot of schooling.
And so you see a wide variety of patients, not only yourself, but within the practice.
Yes. In my particular practice, I see all ages from newborns all the way to 100-year-old patients. So it's a wide variety.
That's great. That's great. And you also do some teaching.
I do. I'm the program director for residency training for otolaryngology, head and neck surgery, and facial plastic surgery for Henry Ford Macomb Hospital. So I continuously am teaching residents and students.
Well, today you're going to teach us. And so I'm going to start out by asking you, what exactly is sinusitis, and what causes that?
Sinusitis is an inflammatory condition of the paranasal sinuses. And the paranasal sinuses are air-filled cavities in our head. We have them in the forehead area called the frontals, beneath the eyes, in the cheek area they're called the maxillary sinuses. There's sinuses between the eyes called the ethmoids, and then one way back in the brain called the sphenoid. And so the condition is an inflammatory condition of these paranasal sinuses, and there's many causes of this. Probably the most common cause of inflammation is going to be the common cold or a virus, but other causes include bacterial or fungal infection, exposure to environmental irritants like smoke or pollutants or secondhand smoke, or also unusual diseases like autoimmune diseases or certain medications as well.
Are some people more prone to sinusitis than others, or is it just sort of a random type of thing?
There are definitely, I'd say probably 2 populations that are very much predisposed to the condition. There's the population that has what we would call an anatomic problem inside their nose. So when you look inside the nose, you see the particular bone structure that the patient's been born with, or maybe altered from an injury. And so the patient that has an anatomy that's not favorable for drainage and ventilation, they're going to be more predisposed to the problem. Or the patients that have allergies, seasonal or perennial allergies.
And what are some of the symptoms of sinusitis?
Sure.
So that, a lot of times these symptoms of illnesses kind of run together,
Sure.
And we may not know if we have a cold or what's going on. So what would make somebody think that they might have sinusitis?
Okay. So we divide the symptoms into major and minor symptoms, and this is very helpful for the doctor to determine whether we're dealing with a sinus infection versus, say, an ear infection or migraine or other head and neck related conditions. So the major symptoms that we're looking for will be facial pain, nasal drainage, mucousy drainage, problems with your sense of smell, fever. Those are the major ones. The minor ones could be ear pain, fullness in the ear, bad breath, cough, headache also, teeth pain. So patients can present with a large variety of symptoms.
So pain seems to be perhaps a distinguishing feature of
Yeah.
sinusitis as opposed to your common cold or something like
Right.
that.
So a common cold may have other symptoms associated with, like cough, sore throat, fever, hoarseness, sometimes stomach problems, intestinal problems. So they have a wider variety of symptoms that affect other areas of the body, where an acute viral or bacterial sinus infection is really symptoms localized to the nose itself.
Is there anything, Dr. Kubek, that a patient can do at home to treat this condition or to help the symptoms?
Sure, there's a lot of good home remedies. So a lot of the patients really don't even need to see their physician. A lot of times, because it could be allergic or it could just be a virus, there's some very simple things that you could do. If you could go to a pharmacy and you could buy a sinus rinse kit. It's basically a little squeeze bottle that you add distilled water to, and you add packets of this specially formulated salt, and you can rinse out your nose and clean out the infected mucus. You could also, if you're exhibiting signs of allergy like itchy watery eyes, sneezing, itchy nose, you could pick up over-the-counter antihistamines, and there's really a variety of them on the market. So most of the time, if you ride out the symptoms for a week to 10 days and things are improving, you might not need to see your physician.
Is there any use for these little pots that steam up the salts?
Absolutely. So the neti pot actually has been very popular, and I think we all know Dr. Oz, and he was really the one that
Who doesn't know him?
right. He's amazing, and so we've been using the saline rinses for a long time, well before he spoke about this on his TV show. But the neti pot is a little teapot that you can add the salt water to and rinse your nose out with, and that's also very popular as well.
Do we know what it is about the salt that helps this out?
Yes. The salt helps to pull fluids out. If you remember back to science class,
Sure.
you can create a hypertonic solution. So what happens is it draws the fluids out of the cells and into the mucus, so it reduces inflammation. It also helps to wash out all that inflammation, all the mucus in there, and it helps the cilia, little hairs in the nose, move the mucus out.
Sounds like everybody should
So
have.
everyone should rinse their nose with saline.
And so when should a patient having some of these symptoms tell themselves, well, you know, this is beyond something that I can take care of? When should they think about seeing a doctor?
Sure, there's several situations that you definitely want to see a physician. Certainly, if you've had the symptoms for a week to 10 days and you're not improving, you'd want to see your physician. If you're having a high fever, if you're developing swelling on your face, particularly around your eyes, or you're having a severe headache that's not really by Motrin or Tylenol, you should for sure see your doctor. If you're having recurrent infections, if you're having 4 or more a year, you should see a physician. If you've lost your sense of smell or having changes in your vision. So there's a lot of symptoms that actually can be very severe and serious.
Dr. Kubek, so a patient makes a decision that they should see a doctor. And how would you, as an otolaryngologist, a specialist in this condition, evaluate a patient and come to a diagnosis of sinusitis?
The most important thing is getting a good history from them. So I really want to bring out those major and minor symptoms. One thing we do not want to confuse is you don't want to confuse sinus infection with a migraine headache, which can have symptoms of facial pain as well. So getting the history of the drainage, problems with sense of smell, congestion is very important. Also to find out more about their environment, ask them questions about allergy. So that's the first thing.
And probably many people are not aware that many of the symptoms that we may think of as a sinus infection really can be similar to a migraine.
True. So that can be confusing. There's a lot of overlap of those conditions. So it's very important to tease out those symptoms when you're evaluating a patient.
Have you ever had a patient who was diagnosed with one of them and you end up saying that you had something else?
Right, that happens. It does happen pretty frequently, and sometimes it can be a hard sell to educate the patient. But once you can do that and you can get them the appropriate treatment, they're very grateful that you've made that change in their treatment course.
Absolutely. So, as an expert in the field, what are the different ways that you can treat sinusitis? Maybe starting out with the more conservative ways first.
Sure. So, to progress from taking the history before we make that diagnosis, there is just one other thing that can be really helpful. We can do a very good examination of the nose, and as an otolaryngologist, we have very special equipment to look in there. We have very bright lights called headlights, and instruments called nasal specula that we can look in the nose. But we also have endoscopes, or little flexible tubes that look like a piece of spaghetti. And we can place some numbing medicine in the nose, a spray, and we can look in there and evaluate their anatomy and look for polyps or tumors. So once we've nailed the diagnosis, there are a lot of medications that we can use to alleviate the symptoms. The conservative treatments, there's really a lot. And most patients we can treat conservatively and don't need to recommend surgery. So some of the conservative treatments we could use would be the saline rinses that we mentioned, sometimes antihistamines if you are concerned that the patient may have seasonal or perennial allergies. You can use decongesting medications, which most of them are actually over-the-counter. We really like to use nasal steroids. So there's a variety of nasal steroids that are sprayed in the nose on a once or twice a day basis. We have nasal antihistamine sprays. We have steroid pills like prednisone or Medrol packs that are very helpful at reducing inflammation, and a whole variety of antibiotics. And the antibiotics we choose depend really on how many infections they've had, when was the last time they were treated, their allergies, what are their medicines they're taking, so we don't have interactions.
Getting back to your diagnosis and using the nasal speculum, are patients sometimes a little bit afraid of having that done?
They are sometimes, yes. They don't know what to expect, and they probably hear horror stories from friends or family. So, and I've had it done myself. I've had my residents practice on me. So
wow,
I know
what a great teacher you are.
I know what it feels like. And with the numbing spray in there, you really can't feel a whole lot other than a tickle. Sometimes it feels like you're going to sneeze. So really, there's no pain involved.
So for that patient who may be a little bit apprehensive, you can reassure them that there are ways to make that more comfortable, and it's maybe not so bad as what they might have thought.
Absolutely, and typically when they're done with it, they're pleasantly surprised, and they almost feel a little silly that they made a big deal about it. Once they've had it done, they realize it was very simple, and it's very quick too.
Good. And when it comes to antibiotics, are there any bacteria that seem to be more prevalent with sinus infections than others?
Of course, there's basically two sets of bacteria that we really look at. There's the bacteria that we look at in the acute setting, and by definition, an acute infection is symptoms lasting for from 1 day to 4 weeks. So in the acute setting, there's 3 common bacteria that we treat: strep pneumonia, Moraxilla catarrhalis, and Haemophilus influenza. And so you have to really look at where you practice, and you have to understand that some of these bacteria are resistant to antibiotics. So typically when we pick an antibiotic, the most common one we use is amoxicillin. I think most people know what that one is. And if that doesn't work within a few days, you want to change to a different one that may indicate that there's resistance. With chronic infections, we look at other bacteria. There's some more atypical ones and anaerobic ones, and sometimes even low-grade fungal infections. So sometimes if our basic antibiotics don't work, we'll switch. We'll also consider doing a culture. We'll go in the nose with a little swab, just like you would use if you had strep throat. Send a culture to the lab, and within a couple days you're going to know exactly what you're treating.
And some people may not necessarily realize, but if not properly addressed, this condition can lead to more serious issues, can it?
Absolutely, yes.
And what are some of those things?
Right, so there are actually some very serious complications of this condition. You particularly see these in children, where the bones that separate the sinuses from your eye and brain are extremely thin, and the infection can spread from the nose into the eye, which could cause blindness. And infections that can spread into the brain could cause meningitis or abscess. I mean, these things rarely happen, but if a sinus infection is left untreated, these things do happen. I do see these things, unfortunately. So.
And when patients are on antibiotics for a sinusitis, can they be on them long-term for a period of time?
They can, but that's controversial. For an acute infection, it's not uncommon to use antibiotics between 7 and 14 days. For chronic infections, it's not as well defined. We may go from anywhere between 2 weeks to 8 weeks of oral antibiotics, but there's a lot of controversy in our field.
So say, for example, you've gone through those methods of treatment, the conservative methods, and maybe they've been on antibiotics or they've had some form of steroid or inhaler, and if those types of things don't work, what other options are available, and where do you go from there?
Sure. The next option would be referral to an allergist. We have an allergist in our practice, a board-certified allergist, so we use Dr. Appleyard quite a bit to evaluate our patients for inhalant allergies, and sometimes you'll find simple things in their environment that they could avoid, or sometimes go on to have desensitization shots, and that can be very effective in reducing inflammation in the nose. Sometimes we'll look for some unusual autoimmune or inflammatory conditions. We may check some blood work too, or sometimes even do some biopsies from the inside of the nose to try to determine if there's some type of inflammation that can be treated with medication. Beyond that, we consider surgery. But I always tell my patients that it's really a quality of life issue, and that if they can live with it, if they can manage it with medications, that's certainly an appropriate treatment. So I like my patients, when they're going to make a decision for surgery, to really come to me and be excited and want to have it, and know that they've tried everything conservatively first. So they're ready to go to that surgery in a good frame of mind.
They probably appreciate that.
So I try to avoid it if possible, for sure.
And so when it comes to surgery, what do you do for them?
Well, it really depends on what's going on anatomically in their nose. Oftentimes the patients have what's called a deviated nasal septum. The nasal septum is a wall in the middle of the nose. It's made of cartilage and bone, and sometimes that's crooked either from birth or from trauma, so sometimes we'll fix that. There's also finger-like projections in the nose. They're called turbinates, and they warm and humidify and filter the air. Sometimes those are too large. We'll make those thinner. But the mainstay of the surgery is to find the openings of the sinuses, and we call those ostia, and enlarge that opening to them. And so there's a lot of ways we can do that. There's traditional sinus surgery, which we would call functional endoscopic sinus surgery, where we find those openings or remove the diseased tissue from the opening area. So we're actually removing the skin and the bone around the opening with instruments. But over the last several years, I've personally gone to a more less invasive way of doing the surgery, and it's a technology called balloon sinuplasty. It's a technology that was borrowed from the cardiovascular surgeons, where we're using a tiny balloon device. We can place that in the opening. We can inflate the balloon and widen the opening and remove the device and create a nice opening, allowing for natural drainage without removing tissue or cutting bone. So the patients actually have a lot less pain. They heal a lot quicker. They have less scar tissue formation after surgery.
That's an amazing advancement.
Yeah, it's really a life-changing advancement for sure.
And I think you have a video.
I do. I have a nice animation video that I'd like your viewers to watch and understand this technology.
Let's take a look at that.
The sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucus membranes may become infected or inflamed because of colds or allergies and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call it sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medication such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new, less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from pain and pressure.
That was great. That was great. So you also brought a device with you.
I did. I wanted you to see, and the viewers to see what the device looks like. The device is basically an apparatus that allows us to bring the instruments into the nasal passages, and this is all done under endoscopy. Endoscopy is when we use a camera. So we use a very thin metal tube that goes into the nose. It's connected to a large HD monitor, so we can see these structures in a very magnified fashion.
So you're using this with the camera, and you're able to visualize what you're doing. That's amazing.
Yeah, we're directly visualizing everything. So the first thing we do is this part of the device here is a wire, and we attach this to a light. We pass the wire into the sinus opening.
And it's coming out over here.
Right, it comes out of the device.
And this is in the, where the sinus opening is.
Right, so we direct the wire into the sinus opening, and the wire has a very bright light on the end of it. We have all the lights out in the operating room, so when the device is in the sinus illuminates, just like if you put a flashlight on your finger, the tip looks orange.
So they're glowing in the dark.
Yeah, so their cheek or their forehead's glowing, so we know we're in the right spot. Then once we know we're in the right area, we can pass the balloon, which is another device this little piece right here.
So that's come out over the wire.
Right, over the wire, so you know you're in the correct spot. Then you can inflate the balloon, and that will open up the sinus passage. If there's mucus in the sinus, we can rinse it out, so we can attach this to a big syringe of fresh sterile water, and we can flush out the sinus and clear it out. This all just takes a minute or two to do it, so it's very, very quick.
That's amazing.
So, and then we remove the device and go on to the next sinus. So it's really awesome.
That's amazing, because the surgical options used to be much more involved.
They were much more involved. And in certain situations, you need to do them. Sometimes there's polyps in the nose and you have to remove them. Sometimes there's tumors. But if there's not, I prefer to use this device. The patients can get back to work very quickly within a day or two.
The patients prefer it too.
It could also be under local anesthetic in the office too.
That's great. That's great. So it's like the angioplasty for the nasal passages.
Exactly.
That's great.
So.
And it's actually amazing how small it is and all the things that it can do, and it can rinse out the area, open up the passage, and you have a light there.
Exactly.
It's pretty neat.
It's amazing stuff.
Anything else that you want to say about rhinosinusitis, Dr. Kubek?
Sure. Beyond the surgery, it's important, though, after patients have surgery, to realize that a lot of these conditions are due to allergy. So it's very important for patients to continue to manage their problems and have a close follow-up with their physician, either their allergist or their otolaryngologist after the surgery, to maintain a healthy lining of the nose. Because despite opening the sinuses, some conditions like polyps, if they're not treated and managed properly, they can come back. So it's very important for these patients to realize that they do have to have a serious commitment to their physician and their care.
And you treat a fair number of polyps. And
I do.
Probably patients have had polyps, or audience members have had polyps, or know of somebody who's had polyps, but don't really know why do some people get polyps, and how do you actually go about treating them so that they go away?
The polyps are basically benign growths that occur in the nose, and they occur from severe inflammation. And the inflammation could be from infection, so it could be bacterial or fungal. But a lot of times, though, they occur from allergies, from untreated allergies, unrecognized allergies. And a lot of times the patients can be very well managed conservatively with medications, using some of the things we've mentioned, like steroid pills or steroid rinses, and then allergy treatment, aggressive allergy treatment. And a lot of times we can shrink the polyps and really improve their quality of life without surgery.
You were sharing with me a gentleman who had quite a significant polyp that you were able to treat that way.
Yes, I was actually, and it was amazing. And actually, my partner referred him to me. He had gotten a CAT scan. He was having some ear problems, and he didn't even realize that he was having problems breathing through the right side of his nose. I don't know how he didn't, but he had good airflow through the left side. And he was referred to me by my partner, and we had the CAT scan, and we could see this gigantic polyp filling the entire right nasal passage, which I also saw when I put a scope in there and looked. And I recommended some medication, and we treated him for a couple of weeks, and he came back, and he was shocked at how well he actually could breathe. He didn't realize that he wasn't breathing well through the right side of his nose, because he'd been like this for a long time.
Must have been life-altering.
Yeah, it was, and I looked in there, and it completely resolved with the medical therapy. Now, that's not always the case. It doesn't always happen, but it is always nice when you can.
When the medical therapy does not work, you can sort of shave them down, can't you?
Right. We can use an instrument that looks a lot like an instrument that an orthopedic surgeon might use to remove loose cartilage in a joint. It's a little shaving device that goes in the nose to remove the polyps, and that can be done very safely with minimal bleeding and also minimal pain too.
I just want to mention something else. You're probably one of the few otolaryngologists who also sees a fair number of children.
I do, yes.
And there aren't that many otolaryngologists who see children, are there?
Correct, right. And you can even use this device and this technology in children as well. And the reason why this device actually is very helpful in children is, one, it's minimally invasive. Two, it's when we talk about doing surgery on the nose, we worry about the growth of the facial bones. So doing a minimally invasive procedure like this can also be very helpful in children.
What other types of conditions do you see children for?
Sure. So a lot of times we'll see kids with recurring ear infections.
I imagine a lot.
Yeah, that's very common. A lot of times we find these kids by just a screening test at the public schools. They come around every year or two, they screen the children. A lot of times kids don't complain of ear pain or even of hearing loss or pressure in the ear. Kids are pretty resilient, they're pretty active, and they oftentimes don't tell their parents they're having any problems. So a lot of times we get referrals for hearing loss. Sometimes we'll get referrals for children that are snoring. That's actually a very common problem. And snoring can lead to problems with sleeping, and sometimes kids develop ADHD. And so getting them to sleep and breathe better helps them.
And you also do cosmetic surgery?
I do. I'm board certified in facial plastic surgery, and so I've always had a strong interest in cosmetic surgery in the head and neck area. I really find nasal surgery, rhinoplasty, a very exciting surgery. It's very interesting to understand what the patient's expectations might be and look at the problem and basically rebuild their nose in a fashion that's functional, which I think is extremely important, is creating a nose that they can breathe through and actually works well, but also one that aesthetically looks nice too.
It's one of the most important structures on the face. It's the first thing that we are greeted with when we meet another person, and it has such an important function.
Yes,
so
for sure.
That's very delicate.
Right.
And then you also treat sleep disorders.
Yes, I do, and that's actually been a very explosive part of the practice, really, with just the education about some of the conditions that actually are adversely affected by sleep disorders. For instance, in children, we're getting a lot of kids that are coming with ADHD and learning problems, and a lot of these children are not breathing well at night. So it's always exciting to be able to offer these kids treatment, but even in adults, we know that it increases their risks of developing heart disease, heart attacks, irregular heartbeats, heart failure. It also makes you sleepy, and that can make you grumpy, affect your mood and your work productivity.
Well,
so,
glad we know we have something to blame that on.
Yes. so it's exciting. We also get a lot of referrals from spouses and significant others too. And I think that's a big referral, actually. A lot of patients don't want to come in because obviously they're sleeping. They don't hear it. It doesn't bother them, but it's usually their significant other, their spouse, that really drives.
That's not getting to sleep.
You got to go.
They're both not sleeping right.
You got to see the doctor now. So.
And Dr. Kubek, tell us again where are the different locations of your practice?
Right. So my group is called Lakeshore Ear, Nose, and Throat. We have practices all over the city. We have one in St. Clair Shores on 12 Mile at the St. John Building. We have a new office that just opened up on the 23 Mile St. John Building by Romeo Plank and 23, a 12,000 square foot office with all the state-of-the-art equipment. It's really fantastic. We have a surgery center attached to both of our offices. We also have one up in St. Clair at River District Hospital, one in Rochester, and one in Sterling Heights.
Well, it's great. Our time flew by, but thank you so much for being a part of the show, and it was a great educational experience. I learned a lot myself.
My pleasure.
And thank you to our viewers as well. As always, we appreciate that you tune in to watch our show. Take good care of yourself and those around you, and we'll see you next time.